Nurses are resourceful. They solve problems in real time. So when clinicians at a Pennsylvania facility saw a trend around IV sites that caused discomfort and kept patients from resting, they knew there had to be a better way. The Medline Newsroom takes you to the Children's Hospital of Philadelphia, where a unique collaboration is bringing bedside innovation and insight to the masses. Each year, more than 25 million IV lines are placed in hospital patients across the United States. Experts say this intervention is used in at least 44% of pediatric patients.
Does it bother you right now at all?
But if that line gets dislodged, even by a simple bump, fluids can painfully leak into surrounding tissue. And when you have to assess, mend, and care for some of the tiniest of patients, new thinking is critical to improving the patient experience.
It's hard because they can't tell you that it hurts, which an adult can probably say, this is starting to feel uncomfortable, and that's one of the first signs of an infiltration. In the infants, sometimes we have IVs in their lower extremities, so it's really all on us to make sure that that peripheral IV stays safe and stays in and allows us to give the medication and fluid that the patient needs.
Many hospitals use a cover to help avoid any tinkering of the line, but you can't see the site, and removal can be noisy and disruptive.
Why can't there just be a window?
NICU nurse and clinical supervisor Jackie Anzalone wasn't the only one thinking the same thing. In fact, another nurse, along with a clinical safety manager at Children's Hospital of Philadelphia, raised the same concerns. All submitted ideas to CHOP's Office of Entrepreneurship and Innovation.
They are, to me, the MacGyvers of the hospital. They're working with devices that don't always meet the needs they have or the needs of their patients, and they have the ability to engineer their way around those problems that they face with their devices.
Their ideas to address an age-old dilemma could only go so far until the team partnered with Medline at the beginning of 2017 to make the SeeIV concept a reality.
Most academics and other healthcare organizations aren't set up to be distributors or manufacturers. So when we discover and create new ideas, we're always going to need to find that good strategic partner. And thankfully, we found one of the best in Medline.
We are great at commercialization. We've been creating medical products and a distribution network for over 50 years. A lot of people who come to us want to scale, and that's what we can do.
As the innovation manager at Medline, Lehner meets with organizations from across the country about bringing new ideas to market.
It is a product manager's dream. This is something that, you get to work directly with the inventors. The CHOP team could not have been more gracious, more involved, more passionate about this project. It's been fun for us. I think it'll be great for CHOP, and it's going to help children. I think it will change the way nurses and caregivers evaluate a site.
A plethora of prototypes were presented.
It does a nice job of securing it to the individual, but also it's quiet.
You can't hear anything.
Nope, but you can still see.
We felt strongly that being able to see the site more directly would allow our parents and our patients to be more partnered with us in keeping an eye on that IV.
We are constantly trying to do better and make things better and be innovative, and we want to deliver the best quality of care to our patients. It was just an incredible opportunity.
A simple design packed with detail and insight.
This was invaluable, and I think when you have two partners like that who come together, it just goes to show anything is possible.
Knowing how important it is for products to support practice, CHOP and Medline are now working together to develop a pilot to see just how the SeeIV can help improve delivery of care among clinicians, patients, and families. This is Vivika Panagiotakakos for the Medline Newsroom. Thanks for watching.